when you listed autism as one of your diagnoses and conditions, of course, I understand it's also a spectrum, right? But I can't help but wonder what other people may think. Like, wait, Courtney, autism, you don't look like someone of the poster child of autistic individual. That's not what the movies and media portray you as. There is no way, right? So like, how has that condition contributed to this process you've been alluding to? But first, there is no context, or there is no content without context. So what is the context of autism? I'd love for you to see how has that contributed to your process.
I didn't know that I was autistic until last year. That I was diagnosed in February of 2023. I was diagnosed with ADHD in August of 2022. So these were my 2 years, 2022, 2023, where I was trying to figure out who I was, my life, and who I wanted to show up as in 2024 publicly. Well, and in my personal life, but the career decision, the ones that everybody listening to this episode will see, will be the public me. I think right off the bat, something that I don't feel comfortable saying, but I have to say and do say every time is, I'm pretty, and people take that as then I can't be autistic. And that's not on me. That's on other people that are autistic. It's this strange concept that people that are autistic can't look normal, sound normal, be normal, because it's supposed to be this abnormal condition. And I've been hesitant to actually show up in the way that I show up, because it's not just pretty privilege. There's many other aspects of my privilege, including privilege within my condition, that allow me to show up the way that I do, being autistic. What people don't quite understand, like you mentioned, there's a spectrum of autism. There's also levels to autism. Some people like them, some people don't like them. For clarity, I am level 1, which is low support needs. So, and the part that plays into that is that autism can come with intellectual disabilities and cognitive disabilities. And I don't have intellectual disabilities or cognitive disabilities. I actually have quite the opposite, something called twice exceptional, where I'm gifted and autistic at the same time. And we won't quite probably go into that, but the symptoms that are most prevalent for me, and why my clinician that I hired last year diagnosed me with autism and said I did not have borderline personality disorder. Let me pause there. I'll pause there. That was validating that the psychologist said that last year. And here's why. People think that borderline personality disorder is a lifelong disorder. It's not. It actually has one of the highest remission rates of mental health disorders once somebody reaches their 30s or 40s. The reasoning for that is they learn that they must develop more traits in order to survive, and they end up eventually doing that.
You say your psychologist said you don't have borderline, but autism.
Thank you. I don't meet the criteria for borderline personality disorder anymore. I still have traits. You must have 5 out of 9 criteria for borderline personality disorder. So do I have the disorder? No. What I say now is I have borderline personality, and I do. And that's just an aspect of how I developed with my traits. And it's something I work on every day. Now, the autism, once over the last 10 years, I was diagnosed in 2012 with borderline. So in 2022, it had been 10 years since my diagnosis, and 10 years since I started working on those symptoms. In 2023, my diagnosis of autism was possible because of the reduction of my borderline symptoms, because of the resolution of some of my trauma responses, so that the actual symptoms of sensory sensitivity, of interpersonal social reciprocity not being possible and being highly anxiety provoking, which may seem pretty surprising with how eloquent I can be on this podcast right now, which we may get into. And several other things that I won't go into for time's sake, unless you'd like to. But I think the main point is that the resolution of the majority of borderline symptoms allowed for the ability to see the underlying actual cause.
Wow, I have quite a few crossroads I can go down to. I do want to go into the empowerment first, and maybe if time allows, we can go into the granular details that you're hinting at. Why do you feel like, and this is I think it's a sensitive question, so I just want to empower you to take this question to where you feel called to.
Okay.
I think there is a fine line between using someone's diagnosis as a crutch, as a shield, as a armor to hide behind. There's nothing I can do. It's my diagnosis. I can't help it. This is how I'm born with. Deal with it. You accept me for who I am. Yeah. If you can't be with my worst, you don't deserve my best. These are the rhetorics I'm sure we both heard. Versus the fine line of, wow, information is empowerment. If I do not know what I'm working with, how can I find resolutions that you just talked about? Where is that fine line? And what do you think about that?
I think I just came up with the best answer I've ever come up with for a question like that in my head just now. And I think it's that is the information, is the diagnosis, is the whatever it is that you're using at the moment, is it a stop sign or a green light? Is it a red light or a green light? Is it I don't have to do anything anymore because I have this label? Or is it now I have a bunch of stuff to do because I'm more aware?